My name is Dr. John Shim, and today I want to talk about cervical disc herniations. That's disc herniations in your neck. It is a very common problem, and most people will come to the office complaining of neck pain with radiation that goes down into the arms. What we do know is discs do herniate for the vast majority of people if you live long enough. After the age of 40, we're going to find disc problems in almost 50% of people. The good news is most people with disc herniations get better without surgical care. But there are situations where you get worse. You don't get better with the standard treatments such as physical therapy, medications, and injections. And at that point, you need to decide if you need to go further with a surgical option. As a spine surgeon, I see people in that situation all the time. And the decision really comes down to multiple factors. Number one, are you healthy enough to have surgery? Number two, does your MRI or CAT scan find an entity such as a disc herniation that is consistent with your complaints? To give an example, if you have a large disc herniation that's pressing on the left side of your spine, if you're only having right-sided pain, most surgeons would be a little bit concerned about that. Your right-sided pain may not actually be caused by that disc herniation on the left side. As surgeons, we want to know that your MRI or CAT scan or studies correspond or correlate to your physical exam findings. When we do a physical exam, we do check to see if you have normal strength to your arms. We do check to see if you have normal sensation to your hands. And we do check to see if you have normal reflexes. If there are changes to your sensation, your strength, and your reflexes, we can get a pretty good idea which nerve is being irritated. For example, the C5 nerve, which is irritated when you have a C4, C5 disc herniation, can cause some numbness to the outside of your upper shoulder and some weakness of the shoulder deltoid muscles, the shoulder extension and abduction function. When you have a C5 nerve and you have some numbness to the outer aspect of the shoulder and you have some weakness to the deltoid, that can indicate a C5 nerve problem. If you don't improve with non-surgical care and the MRI shows a pretty large disc herniation at C4, C5, and you persist to have increasing pain or you develop weakness and severe increasing pain, surgery may be an option for you. When we do surgery, the standard procedure is something called an anterior cervical discectomy infusion. Basically, we make an incision to the front of your neck. Most of the dissection is then done bluntly by your finger. The finger will actually spread apart the muscle planes and the tissue planes until you're able to reach the front of the neck. Once you reach the front of the neck, you can identify the disc at the different areas. You will put a needle within the disc. You'll get an x-ray to confirm you're in the right position. Then you will remove the disc material from the front going towards the back. Once you get towards the back of the disc, there's a ligament called the posterior longitudinal ligament. Typically, there's a hole in that posterior longitudinal ligament where the disc herniation would come out and then hit the spinal cord or the nerves. Using very small, fine instruments like micro tweezers, we basically remove those disc herniation pieces so it no longer presses on the spinal cord or the nerves. Once the disc herniation is removed, we take a piece of bone, usually from the bone bank, and we fashion it for the right size and place it within the disc space at the C4, C5 level for a C4, C5 disc fusion operation. Once the bone is placed into the spine, we then use a plate and screws to fixate that bone in proper position, and it basically holds the bone in that position for the duration to allow the bones to fuse properly and maintain its appropriate space. Once the fusion is performed, you really don't need to place and screws anymore, but you really don't need to have another operation just to remove the plates and screws. In the end, when you have a disc herniation that causes corresponding arm pain and is consistent with the findings on the MRI to that arm pain, and you don't improve with non-surgical care, surgery can and often is helpful to that situation. I'm Dr. Shim. I'm talking about anterior cervical discectomy and fusion and disc herniations for the neck. Thank you for taking the time to listen.